Right now, at this very moment, there could be a disease quietly developing inside your body and you have absolutely no idea. No pain, no fever, no obvious symptom, just fatigue, which you have been blaming on the weather. More than 30% of the people worldwide are affected by this disease. This disease is called fatty liver disease, and today I am going to tell you why it happens, how to recognize it, and most importantly, how it can be completely reversed without any expensive medication. I'm Dr. Raza, and you're watching Dr. Raza Health Channel. I have been practicing as a family physician in the USA for 18 years, and in this video, I will share everything your local doctor usually doesn't tell you. Our liver is the hardest working organ in the human body. It performs over 500 functions: digesting food, filtering toxins, producing cholesterol, regulating blood sugar. Normally, the liver contains a small amount of fat, and that is perfectly fine. But when more than 5% of the liver weight becomes fat, this is called fatty liver disease. And when that fat begins causing inflammation inside the liver, it's called MASH, which is much more dangerous stage. The new scientific name for this condition is MASLD, metabolic dysfunction associated steatotic liver disease. It used to be called NAFLD. The name has changed. The disease is the same. Fatty liver progresses through 4 stages. Stage 1, just fat. Stage 2, fat plus inflammation, called MASH. Stage 3, fibrosis, scarring begins inside the liver. And stage 4, cirrhosis. The liver is permanently damaged. After that, the risk of liver cancer increases. The good news is, in stage 1 and 2, this can be completely reversed. But for that, early recognition is essential. In my clinic in the USA, the most common causes of fatty liver is number 1, sugar and refined carbohydrates. Rice, white flour, sugar, sweet drinks, all of these are converted directly into fat and stored in the liver. Number 2, obesity and belly fat. If a man's waist is over 40 inches or a woman's over 35 inches, the risk of fatty liver is significantly elevated. And number 3, type 2 diabetes. 58% of the diabetic patients have fatty liver because insulin resistance causes fat to accumulate in the liver. A sedentary lifestyle, sitting on a desk all day, scrolling on your phone, or no exercise, this gradually builds in the body. And one very important point, fatty liver is not only a disease of overweight people. Lean fatty liver also exists. People who appear thin on the outside but have fat accumulating inside their liver, this is especially common among South Asians. Now, fatty liver is also called a silent disease because in the early stages, there is no pain, but the body does send signals, which we tend to ignore. Symptom number 1, persistent fatigue. Waking up tired even after a full night's sleep. This could be a sign of liver exhaustion. Symptom number 2, heaviness in the upper right abdomen, or called right upper quadrant, right here, and a mild feeling of pressure just below the right ribs. This can be a sign of an enlarged liver. Symptom number 3, loss of appetite. If you don't feel as hungry as before, this could be a signal from your liver. And symptom number 4, elevated liver enzymes in the blood test, ALT and AST. These are 2 enzymes that show up in the blood work. If they are elevated, the liver is under stress. Symptom number 5, bloating and gas, constantly feeling full, bloated, gassy. And there is also symptom limited to poor liver function. And the most critical point, 80% of fatty liver patients have no symptoms at all. That is why regular screening through ultrasound and blood test is essential, especially if you have diabetes, high blood pressure, or obesity. Now, in USA, whenever I suspect fatty liver in a patient, I always order these tests. First, blood test called LFTs, liver function test, which we look at AST, ALT, and GGT. If these are elevated, the liver needs immediate attention. Second, abdominal ultrasound. This is the easiest and most affordable method. An ultrasound clearly shows liver fat graded as grade 1, 2, or 3. And third is fibroscan, a specialized ultrasound that measures scarring inside the liver without a biopsy. If fibroscan is not available, the FIB4 score can be calculated. It uses age, ALT, AST, and platelet counts. It is completely free, available online calculators. Now, this is the most important part of this video, and I want you to really listen carefully. Fatty liver, especially in stages 1 and 2, can be completely reversed. No special medication needed, just lifestyle changes. Step 1, and the most important, lose weight. Research shows that losing just 5 to 10% of your body weight significantly reduces liver fat. Now, if you weigh 80 kilograms, Losing just 4 to 8 kilograms will make a real difference. Step 2, Mediterranean diet. The Mayo Clinic and all major international guidelines recommend this. What to eat: vegetable, lentils, fish, olive oil, and walnuts. What to avoid: sweet drinks, white rice, bakery items, fried foods, tea, and coffee without sugar. That has been proven very beneficial for the liver. Studies show 2 to 3 cups of black coffee per day improves fatty liver. Step 3, exercise. Just 30 minutes of brisk walking every day is enough. You do not need to go to gym. 5 days a week rapidly reduces liver fat. Step 4, avoid sugar and refined carbohydrates. Cold drinks, juices, bakery items, white rice, white flour, these go straight to your liver and become fat. Step 5, vitamin E. US guidelines indicate vitamin E may be beneficial for non-diabetic fatty liver disease, but only under a doctor's supervision. And a brand new development. In August 2025, the FDA approved semaglutide, Ozempic, for the treatment of MASH. In 2024, the first dedicated MASH drug, resmetirom, was approved. Medical science is advancing, but lifestyle changes remain the most powerful treatment available. I live in USA, and I know the awareness about fatty liver is very low. People visit doctors only when it's already too late. If anyone in your household has diabetes, get their liver ultrasound and LFTs done today. If they have high blood pressure, get it done. If they're overweight, get it done. These are inexpensive tests and they can save lives. Fatty liver progressing to cirrhosis and then liver cancer, it's a long but silent journey. The best time to stop it is today and right now. So starting today, do one thing. If you have diabetes, high blood pressure, or obesity, ask your doctor for a liver ultrasound. And if you don't understand your report when it comes, write it in the comments and I will personally respond. This channel exists for one purpose only: your health. If this video was helpful to you, please subscribe, like, and share it with anyone in your family who has diabetes or is overweight. They will thank you for it. Remember, your liver can heal. You just need to catch it in time and take the right steps. Take care of yourself. You are watching Dr. Raza, Health 360 MD, and your better health is my mission. Goodbye. My name is Dr. Raza. I am a practicing family physician in USA for the past 18 years. I am an American board certified physician and diplomate of American Board of Family Medicine.